Hello, my name is Dr. Kristen Higgins, and I'm a radiation oncologist at Winship Cancer Institute of Emory University, specializing in thoracic malignancies. The role of consolidative thoracic radiation therapy in patients with extensive stage small cell lung cancer is an ongoing question and comes up in the clinical management of our patients quite often. The idea of giving radiation to the chest after chemotherapy in our patients with extensive stage small cell lung cancer has been evaluated in several trials. The largest trial is a trial conducted in Europe by Dr. Slotman and colleagues. And this trial looked at giving 30 gray of radiation to the thorax after chemotherapy in patients that had had some response to chemotherapy. And it did not show an improvement in survival at 1 year, but it did at 2 years. The primary endpoint of the trial was survival at 1 year. So it didn't meet its primary endpoint, but yet there was still this survival benefit seen at 2 years. And that has led to the adoption of consolidative thoracic radiation in extensive stage small cell lung cancer. Now, I will say that not every center in the United States gives consolidative thoracic radiation for small cell because of the controversies about the trial that I just mentioned. But certainly we know that in patients with small cell lung cancer, they do tend to relapse in the sites of original disease in the chest. And we also know from the Slotman trial that the patients that benefited the most from consolidative thoracic radiation were patients that had residual disease in the chest after chemotherapy. So those are the patients that, again, I think this treatment should be used for. Now, one caveat is that the Slotman trial was conducted in the era of chemotherapy alone for extensive stage small cell lung cancer. And we know now that the standard of care has changed and is now chemoimmunotherapy given as frontline treatment in extensive stage disease. And so that brings up a whole new question about the utility of thoracic radiation. We do have some safety data showing that thoracic radiation in the setting of immunotherapy is safe, but we don't have any idea of the impact on survival it may have. There is a recently activated trial, NRG Oncology LU007, that is assessing the role of thoracic radiation after chemoimmunotherapy with atezolizumab. And in this trial, patients will get chemoimmunotherapy with atezolizumab and then will be randomized to either maintenance atezolizumab alone or radiation to the chest, as well as other metastatic sites, up to 5 ISO centers of treatment, along with the maintenance atezolizumab. And that trial is going to be just over 300 patients. It's a phase 2/3 trial. I think that will be a really important trial for us to sort of understand if thoracic radiation is something that benefits our patients. And I think there's a lot of excitement around this question because of the potential synergies of radiation in the setting of immunotherapy. So this consolidative thoracic radiation question is actually more exciting now than it used to be before immunotherapy became standard of care in extensive stage disease.